Hi, I'm Stacy Rizza. I'm an infectious disease physician at the Mayo Clinic in Rochester. I am the chair of the HIV clinic at Mayo, and I'm here to discuss a recent publication in the Mayo Clinic Proceedings that discusses HIV testing in the United States. The name of the article is HIV Screening in the Healthcare Setting, Status, Barriers, and Potential Solutions. This paper addresses a recommendation by the CDC in 2006 that all adults in the United States should be screened for HIV. This recommendation specifically says that every adult should have at least one baseline test. If the physician or the patient feel that they are engaging in high-risk behaviors, the healthcare provider may choose to do HIV testing more often. However, any patient that comes into a healthcare setting, whether that's an emergency room, a follow-up for a blood pressure check, or a general medical exam, should at least be asked or documented whether they've ever been HIV tested in the past. If they have not, they should then be offered an HIV screen. There are about 1 million people who are HIV infected in the United States. Unfortunately, about 20% of people in the United States who are HIV infected are unaware of their HIV status. So they've never been screened for HIV, it's never been thought of or offered to them, or they have never chosen to be HIV screened, and they're still transmitting the virus. Of the people who are HIV infected and aware of their status, only about 60% of those people are linked to care in the United States. Only about 45% retain care, and only about 40% are ever started on antiretroviral therapy or treatment for HIV. And of those, only about 25% to 30% have effective HIV care. So you could see that we still have a long way to go in the United States to assure that people who are HIV infected are getting appropriate and aggressive care, and therefore will do better themselves, but also will transmit less HIV within the United States or wherever they are exposed. There's some new data, even within the last 6 years, that people who are aggressively treated for HIV are less likely, dramatically less likely, to transmit their HIV sexually, whether that's men who have sex with men or heterosexually. So we have many reasons in the United States to assure that we document, we test, and we link these patients to care so that we can treat them and prevent further spread of this infection. Now, when it comes to testing these patients, there's considerable evidence that we as healthcare providers in the United States are doing a fairly poor job of following these recommendations and screening the United States population when they're in the healthcare setting for HIV. This paper addresses some of the barriers to screening the patients and some possible solutions. It addresses firstly making sure that healthcare providers are aware of this recommendation. Healthcare providers are aware of how this needs to be done, how the follow-up should occur, and assuring that people who are HIV infected have linkage to their care. There's some interesting issues addressed in the manuscript and many potential solutions offered to help us as a country, and particularly as healthcare providers, curb this epidemic of HIV and assure that further Americans are not infected with HIV. One of the questions is, how do patients feel about this recommendation? And there is some evidence earlier on in the HIV epidemic that people in general, and patients as well, who were in healthcare settings, were uncomfortable with being HIV tested, that they were worried that there would be social or moral implications if they were HIV positive. They worried about insurance. However, other data suggests that patients are actually very comfortable with this and many times assume their doctor had already tested them, and assume that as physicians we would have thought of this and we'd make sure that they're healthy and don't have HIV infection. Now, if a physician is to offer it, many are concerned that they would have to document consent, they would have all sorts of legal implications, and that it would take time. However, what many healthcare providers are not aware of is in the vast majority of states, 48 out of 50 right now, the physician does not need to document consent to have an HIV test. The testing as dictated by the CDC is called an opt-out test. So a healthcare provider offers the test to the patient. If the patient says, no matter what, please do not check me for HIV, then of course the healthcare provider would not check them for HIV. However, as long as the physician is notified and they do not opt out from being tested, the healthcare provider is free to proceed with the test and tell them about the results when those return. The next steps in ensuring that as a country and as healthcare providers we follow these very important recommendations is to assure that all healthcare providers and all facilities are aware of the recommendation and have mechanisms in place to enact the recommendation. Whether that be have decided who in the healthcare setting asks the patient whether they've ever been tested or documents their HIV test, who asks them if they are ready to be tested at their institution, and who follows up with the test result. And we would encourage all facilities to come up with a mechanism to do this so that we no longer miss this infection and allow future people to become infected. The take-home message of this paper is most importantly to make all healthcare providers aware of this recommendation. The next take-home message is to make all healthcare providers aware of the implication of testing and not testing. To particularly emphasize that at this stage in the HIV epidemic, we have good therapy, and treating patients is effective at not only prolonging the patient's life, but preventing future infection. So by not knowing the recommendation, or by not following the recommendation, in many ways we are actively allowing further people to become infected, and we have to take every measure we can to prevent this from happening.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.